All right, so item 5, we've now got our healthcare provider returned our page and we have new orders. So let's see what we got. Maintain MPO status, like we discussed in the previous question, inserting that nasogastric tube to low intermittent suction, giving piperacillin tazobactam, which is an antibiotic, lactated ringers for continuous IV fluids, IV morphine for pain, and then ondansetron for nausea. Good. These are all the things that we decided are indicated for this client. So next, we're asked to address the client's symptoms. The nurse should first blank, next the nurse can blank. And we have the same options for each blank here. Administer IV morphine, administer IV ondansetron, and insert the nasogastric tube. So of these, we're going to do one first and one second. So when we're prioritizing, when we're thinking about what to do first, we want to prioritize issues of airway, breathing, and circulation. In this case, this guy has been vomiting, he's lost fluids. We want to stop that vomiting, to stop the volume loss and prevent an issue of circulation from developing. So I think of these, I want to prioritize the ones that are going to relieve his nausea. So of those, we discussed how, of course, giving an anti-nausea medicine will do that, and then inserting the nasogastric tube will do that. But what does this look like if I do these things first? Am I going to let this poor elderly gentleman sit here with severe 8 out of 10 now abdominal pain while I'm sticking a tube down his nose? No, I think that's cruel. And also, if we have another tool at our disposal, the IV ondansetron to relieve his nausea, that can work a lot more quickly than a nasogastric tube would. So to give IV Zofran, you just have to get it from the medication machine and give it in the IV. And because it's given IV, it works almost immediately. So that could relieve his nausea without the NG tube ever going in. So I think I'm going to do that first. And then as far as what's next, I'm either going to give the morphine or insert the NG tube. We spoke about how long it might take to put an NG tube in. You have to get your equipment. Usually you have to get someone to help you. You have to insert it. And then before you can ever hook it up to wall suction, you have to get a chest x-ray to confirm its placement. This is going to take a long time. And it's also a really uncomfortable procedure. This is going to make him gag. If we hadn't given the Zofran first, it might even precipitate more vomiting. And it's a painful procedure that because I have the option to give Zofran, let that start treating his nausea, there's less urgency to get the NG tube in, and I can pre-medicate him with morphine for this procedure. So I'm relieving his nausea, I'm relieving his pain. And yes, we're correct.